All right, beautiful people. We are here today working on plantar fasciitis. So, this client, she has had no previous injuries, but it's all repetitive motion, and she's actually starting to compensate with the outside of her foot on the other side. So, we're gonna work on this one first and see what we can find there. It's gonna be mostly in this area. Let me show you a view real quick that I noticed. If you can see both of her feet right here, there's more of a shadow right there because she has more of an arch developed right there versus right here. It's definitely less of an arch. I can even feel the tension just right there. And then if we look at her toe from this angle, it's definitely tilted in a tiny bit there. So it's gonna be more of the inside of the toe area versus the outside. So we're gonna try to get the toe released first because that will relieve tension where she's feeling most of the pain where it connects down in here. So my idea, what I'm trying to accomplish, is to start here and release everything down this direction so that the tension is relieved here. Because if I start pushing everything this way, it's gonna create more weakness where this is already trying to work so hard to hold. So with that in mind, first thing I'm gonna do, before I even put lotion on, because I like to have a good grip, so I'm gonna hit the nerve area by palpating the base of the toe where I feel that it's the most twangy, tight spot on the whole toe, pulling it this way. So I feel it not so much on the exact side of it, but a little bit slightly posterior. So that reflexology point also indicates tension over by her SCM attachment on her neck. So that's probably tight too. But I don't have time for that today. We're just gonna work on the foot with the plantar fasciitis. So right now I'm palpating because I want to find at the base of the toe where it's really tight. And I'll be using reflexology, possibly cupping, but definitely some scraping because I know that there's going to be some crunchy adhesions to break up in order to relieve all of that tension. So at the base here, where I found it, I go up a little bit higher, right above the joint at least, and there's typically, it might feel like a tiny little knot, it could feel like a grain of sand or just a twangy little tendon in there, but I want to push in and then with the intent of pushing down towards the joint to release that. And it'll be tender. They might have to breathe it out a little bit, but you want to get that whole fascial line all the way up the leg to disengage. And some people it takes longer than others, but we're waiting for this to melt a little bit more. Take a deep breath. There it goes. So that was a good release. So I don't know if you can tell, it's already straighter. So after I released that, I did a little bit of manipulation in this joint, and it's already popping and moving, but I can tell that there's still some restrictions keeping it from staying where it should, which this has quite the it's small, but it's a callus, which is indicating the point where they push off with the pressure when they walk. Because you want to keep your toes relaxed when you actually walk and utilize your core to lift your foot off the ground instead of pushing your foot off the ground, if that makes sense. So right where this callus is, that'll indicate where I need to release as well. So I push in right here and pull down, because this one is more on the posterior side of the toe, not so much right on the side. So with that release, I got this one to move a little bit with that joint manipulation. And so I go back up to this one, and it moved quite a bit more. And now there's no popping or feeling anything. Oh, that was a good pop.
Yeah.
That was the release we were looking for. So we got that nice and released. So now that we've dealt with that, we can travel a little bit further down. Try to stretch this one out. I feel the crunchies. So we're going to use a little bit of lotion. Relax. She's helping. She must be really good at being a leader. All right. So I want to take my Graston tool, and there's a little bit of an edge right here, and I want to use that to break up the adhesions right here on the toe. And I have to be kind of nice because this is her first time doing this. Relax. It might tickle a little too, but deep breath. We're gonna get it done fast. Okay, it's a sensitive area. All right, so now that we got that warmed up and released, it'll allow the tension in here. It already has its arch back. Do you guys see that? The arch is back already. I don't know if you can tell, but I can tell. And then there's still a little bit of tension right here. I wish you guys could see what I can feel. But this is right by, she did mention that sometimes her low back does bug her. This is the sacrum in reflexology. So right next to it, there's some good tension. So we're just gonna push on that for a second. Take some deep breaths. I don't feel crunchy, so I'm not gonna scrape it. Just some tension. There's no crunchies, but I definitely feel like there's a level of scar tissue adhesion right here. Like deeper into the muscle, not so superficial in the fascia. So I'm gonna scrape right here, that little spot. Deep breath. All right. That one I think actually probably needs a cup because it's not loosening up like I want it to. So I'll leave a cup right there for a second, and then I'll palpate the rest and see how it feels. Always pushing down towards the heel. Yeah, that's actually not bad in there. So she's feeling all of her pain right here. I'm gonna put this on a little bit harder. Okay, that one's on really good. We'll wait for that to do its job. In the meantime, we can address this side. For the pinky toe, that's doing all that compensating. So what I'm feeling is, where is it the tightest at the base? And sometimes it's obvious, sometimes it's not. I'm feeling it right here. She's already reacting. Okay, a little bit higher, right above the joint, and it is very active. It is very tense. Like, it's definitely a good knot in that pinky toe because it's working so hard right now. This is where she's pushing off the hardest when she uses her left foot. And she's breathing through it. Good job. It's almost relaxed. All right, that's better. A little bit of joint manipulation to kind of allow things to move where they should if they want to. Oh, yep, there it goes. We got this one. All right, palpate down to the hip. That feels pretty good, actually. So she must not be compensating, at least not for too many years. This seems like something more short term than what is going on with the other foot. So I'm happy with that, actually. So back to the main event. All right, we'll see how that did. There is going to be a cupping mark, maybe. All right, so with this, we just want to push right on it towards the heel. Stretch the toe a little. Hi, guys. Okay, so now that that is nice and released, I had a lot of help with that cup. We're gonna see if, relax, there you go. We're gonna see if anything wants to move as far as joint manipulation goes. So I already did the big toe, and the intent is to go this direction and or this direction. Going down this way is going to overstretch the top of the foot. So unless the foot looks like that, we already got the ankle to move. Unless the foot looks like this, you're not going to be stretching this direction. Because most feet don't have that 90-degree angle. This is her natural fall. So if it was happy, it would look like that, without the toes getting pulled that way. So that's why we're gonna stretch this direction and away from the toes. And that'll actually help with turf toe as well, because turf toe is the overstretching and underdevelopment of the top muscles. So the joint itself is having a hard time just staying together when it has no support. So this is good for turf toe and plantar fasciitis. So with that released, we're gonna grab the base of the foot area here by the ankle, and we're gonna grab kind of the ball of the foot area, and we're just gonna do some rotations here. Hold this one steady and move up here. And it should move this area where it wants to go. I feel it. There we go. I don't know if you guys can hear that pop, but it went where it needed to. So, on that note, I do feel a little bit of crunchies right here. So since I got this released and I got this released, the crunchies here are gonna be what's causing most of the inflammation where it connects right here. So we're just gonna end with a little bit of the scraping. We did scraping up here, but this is gonna be where it's gonna be the most sensitive. It might tickle more. People are definitely gonna squirm, so maybe you can do it with them face down, but she's gonna be face up for this. And I'm not using the sharpest part. It's gonna be like more on the other edge area where it's a little more blunt. You see that? It's got two edges instead of that sharp edge right there, this one. So we're gonna use the other side. And it'll still do the job, but it won't be as much of a torture session, which I don't like to torture people, but I do know that I have to be mean enough to do what's effective because I care. So with this one, we're gonna start at the top, and I feel a lot of crunchies just right here in the middle, and I lift at the bottom, and then I come back up. Up here, I was going back and forth, which didn't really matter too much, mostly to get it loosened up and moving. But this is where I really want to release those crunchies. So I'm gonna hold your toes back, get that straightened out a little bit more. And most of the crunchies I feel popping are right here. Take a deep breath. And I don't know if you guys can see this, but she's already getting red, like right here. Closer. Like right in here, which tells me that is the worst spot that needs it the most, because usually it doesn't show up like a hickey mark, like most cupping does or scraping does. It depends on the person on how red it gets and how fast it gets red, but typically I found that if there's an area that really needs it, it'll show up in the specific spots that need it the most, even if you scrape the whole area around it. So this is my sign and indication. This is where I need to focus, right here. So we're gonna just get this over with real quick. Breathe it out. Not that much longer. 5, 4, 3, 2, 1. Okay. I had to give her an ending point to look forward to. So I don't know if you can see this now. It's showing up a little bit more. This is exactly where we scraped that got really red. Right there. So in the future, I'm gonna know exactly that's the source of majority of her pain. But I hope this helped you guys, because this is a problem for a lot of people. They try to roll like a water bottle with ice on it. They try to do compressions, but the reality is no amount of pressure or massage is actually gonna get that worked out unless you use a tool like this. And you don't want to use a tool like this and make it worse if you don't know what you're doing. So if you guys have any questions, feel free to reach out.